So the medication syringe may come from Omnicell or from the pharmacy. And you'll see that we put some red liquid in there. Of course, the liquid is not going to be red, it will be clear, but hopefully that'll help you see a little better. But you do have to be careful when you're priming the tubing because the fluid is hard to see, and hopefully this will help you in the directions. If the medication comes from pharmacy, the green bag will surround the syringe. It's going to need removed in order to be scanned. So then the patient's armband and the syringe box or bag will be scanned, and you have to remember the two RNs will be verifying all parts of the process. Okay. So if the patient does not have primary IV fluid running, set up and manually prime the tubing for a primary KVO IV line using normal saline or other fluid designated by the provider. Don't set the pump up at this point. Just wait to set the pump up. What about if the patient already has primary fluid running? Ensure this compatibility of the fluid with the pain medicine first, and then disconnect the primary IV tubing from the pump and the patient's site, leaving the blue PRN adapter attached, and make sure you cap the IV tubing to maintain sterility. Of course, you'll flush the blue PRN adapter as well. So now what you're going to do is attach the long end of the IV PCA tubing to the medication syringe. So that's the long end. And you're going to manually prime the IV PCA tubing with the pain medicine to slightly beyond the Y of the tubing, not all the way down. So Amanda's going to do this very slowly to show you just slightly past the Y, where you'll be leaving air in the last part of the tubing past the Y for now. Okay, very good. Now you might be thinking to yourself, we're manually priming, the pump's not going to track this amount. That's true. 2.6 cc's is required to prime the tubing, and that will not be tracked, but our pharmacy is okay with that when we record the wasting at the end of the therapy. So the next thing we have to do is attach the primary tubing to the Y connector of the PCA tubing. Of course, you get your PCA tubing, maybe from Central or maybe from your stock. You have to do it this way. You cannot plug the PCA tubing into the primary tubing. It must be this way around. There is a back check valve, see right there, and what that will do is it will prevent the medication from flowing backwards into the primary tubing. If you don't set it up this way, that medication could flow back into your primary, and you wouldn't want that to happen. Then you cap your end. And now we're going to prime the short end, that little piece that's left of the IV PCA tubing, using the primary fluid. So when priming is complete, the primary infusion fluid should occupy the tubing between the Y site and the patient. So that's primary fluid in there, because if you don't do that, the patient will get a bolus of medicine when you begin. So now we're going to talk about loading the syringe. Use the PCA pump key that comes from Omnicell to open the syringe barrel. And you have to turn to the unlocked position, which looks like the locked position, so that is a little confusing. Now you're going to insert the syringe. Big importance here. You have to put the flat edges of the barrel under the gray piece with the screws. So we're going to zoom in on that so you can see that. That's the first thing you can do. It's in the center, and make sure that's the first. So the center is the first thing you do. Put those flat edges like little wings under the gray piece with the screws. Now once you've done that, you take the gray gripper control that's up at the top, you turn it clockwise and lower that till the grippers rest below the top of the syringe plunger. So it's kind of grabbing the top there. That's the second thing you do. And lastly, you're going to take the clear plastic syringe barrel clamp, pull it straight out, then turn it, rotate it so it sits right on the syringe barrel. So first is that middle part, then the top, then the little clear thing. That's the order of it. Then you can lock the door and you leave the key in for now. From there, you'll go ahead and program it with your two nurses, and that'll be your next video. Thanks a lot. Hope this helped.